England is facing a significant surge in norovirus cases. This is putting immense pressure on our already strained NHS. Norovirus, often called the winter vomiting bug, is highly contagious. It causes unpleasant symptoms like vomiting and diarrhea. Recent data paints a worrying picture. Hospitals are seeing a sharp rise in norovirus admissions. Last week alone, an average of 784 patients were hospitalized daily with the virus. This is an alarming 80% increase compared to the same period last year. These figures are the highest we've seen since January 2020. This surge in norovirus cases comes at a time when the NHS is already grappling with winter pressures. Flu and COVID-19 cases also remain a concern, further stretching resources. This situation is a stark reminder of the challenges our healthcare system faces, particularly during the winter months. The impact of this norovirus surge on the NHS is significant. The highly contagious nature of the virus makes hospital management challenging. When cases are identified, wards often have to be closed for deep cleaning. This is essential to prevent further spread, but puts a strain on bed availability and staff resources. The situation is exacerbated by the fact that many hospital beds are occupied by patients who are medically fit for discharge but require social care support. This backlog further limits the NHS's capacity to cope with the influx of norovirus patients. While flu cases have decreased from their peak, they still pose a significant challenge. Hospitals are still seeing around 3,800 flu patients daily, 2.5 times higher than the previous year. Additionally, COVID-19 continues to circulate, with an average of 1,000 daily hospitalizations. This combination of factors is putting immense pressure on the NHS. Staff are working tirelessly to provide the best possible care, but the system is stretched thin. Recognizing the severity of the situation, Health Secretary Wes Streeting has acknowledged the immense pressure on the NHS. Despite some improvements in flu rates and ambulance handover times, the surge in norovirus cases is a cause for concern. The government is urging the public to play their part in mitigating the spread of norovirus and other winter illnesses. The message is clear: vaccination is crucial. Those eligible for flu and COVID-19 vaccines are strongly encouraged to get vaccinated. The NHS is also advising the public on how to prevent the spread of norovirus. Good hygiene practices are paramount. This includes thorough hand washing with soap and water, especially after using the toilet and before eating or preparing food. Alcohol gels, while effective against many germs, are not as effective against norovirus. If you experience symptoms of norovirus, it's vital to stay home for at least 48 hours after symptoms have subsided. This helps prevent spreading the virus to others, particularly vulnerable individuals. Staying hydrated is also important, especially for young children and the elderly. We can all play a role in alleviating the pressure on our NHS. By taking simple precautions, we can protect ourselves and those around us. Vaccination remains our strongest line of defense against flu and COVID-19. Maintaining good hygiene is crucial in preventing the spread of norovirus and other infectious illnesses. Wash your hands frequently with soap and water, especially after using the toilet, before handling food and after being in public places. If you do feel unwell, stay home to prevent spreading germs. This is particularly important if you have symptoms of norovirus, as it is highly contagious. By following these simple steps, we can all contribute to reducing the spread of winter illnesses and support our hard-working NHS staff.